The Department of Neurosurgery here at St Vincent's Private Hospital is one of the oldest in Australia. It's also one of the busiest in the state, doing more than 1,500 operative cases per year. We are fortunate to have a dedicated neurosurgery ward, meaning our nurses are experts in the care of these patients. We've had a number of notable firsts, pioneering technologies before others. We're the first hospital in Australia to employ frameless stereotactic equipment in the routine provision of craniotomy. This equipment is now considered standard practice in the treatment of brain tumour removal. We're also the first to undertake successful endoscopic pituitary surgery and deep brain stimulation for Parkinson's disease.
Historically, spine surgery was considered high risk with a long recovery process. This was due to the invasive nature of the surgery, which involved removing a large amount of muscle and tissue to access the spine. Here at St Vincent's Private Hospital, we've been leading the way in which neurosurgeons carry out spine surgery. We were one of the first sites in Australia to implement minimally invasive surgical techniques and precise intraoperative imaging technologies. We're fortunate to have access to some of the best and safest technology for minimally invasive spine surgery. During spine operations, our team utilise the Zeem intraoperative CT scanner and BrainLab navigation equipment, which helps make the surgery more accurate. This functions like a GPS system for the spine. What's unique about this is that for each individual patient, we have access to real-time data with the patient's own imaging. At all times, we know precisely where the neural structures are, allowing us to fulfil the goals of the surgery.
Spine operations are delicate. Each patient is unique and treated on an individual basis, with tailored treatment plans created. As neurosurgeons, we treat spinal conditions, including acute disc prolapse, sciatica, and brachyalgia, which is arm pain resulting from spinal nerve compression, degenerative disorders of the spine, as well as benign and malignant spinal tumours. We have access to world-class nursing expertise and operating theatre support to allow for open, minimally invasive and percutaneous surgery depending on the patient's requirements.
We have a dedicated movement disorder program, treating conditions such as essential tremor, Parkinson's disease and dystonia. We treat them with deep brain stimulation surgery and now also MRI-guided focused ultrasound. As a department of neurosurgeons, we work closely with neurologists to provide most advanced treatment options for these patients. The more common type of tremor is called essential tremor, which can cause significant disability in completing basic tasks such as eating, drinking and shaving. In 2018, we performed the first incisionless procedure to treat a severe tremor using the MRI-guided focused ultrasound procedure. This was a first in not only Australia, but the Southern Hemisphere.
For patients with pituitary tumours and skull-based tumours, we offer the latest in endoscopic approaches. We've completed the highest volume of pituitary tumour surgeries and acoustic neuroma surgeries in New South Wales, working closely with a multidisciplinary team to achieve optimal results. It's important that the team includes experienced neurosurgeons, ENT surgeons, neuroradiologists, neuro-oncologists, and most importantly, experienced nursing staff.
At St Vincent's Private Hospital, we have specialist expertise in the management of benign and malignant brain tumours. We have sophisticated microscopes and surgical navigation systems to enable the safest, most technically advanced brain tumour surgery. The introduction of the Zeiss Carnevo microscope means that we can continue offering the highest quality of multidisciplinary brain tumour care. We want our specialist expertise and our sophisticated equipment to translate into the best possible patient care.
In the treatment of brain and spine cancers, it is essential that a multidisciplinary approach is taken. At St Vincent's Private Hospital, we are proud of our comprehensive neuro-oncology service. Our neurosurgeons work closely with neuroradiologists and pathologists, neuro-oncologists and radiation oncologists to create individual treatment plans to best treat our cancer patients. We are fortunate enough to be involved in groundbreaking trials through the Garvan Institute. One exciting trial is the MOST study for patients with rare cancers, where we are able to personalise experimental treatment based on an individual's personal and cancer genetic profile.